What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, August 23rd, 2024. If you're new to my channel, this is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of viruses out there, and you need to know what's going on with each and every one of them. While our focus today may be COVID, we do talk about these other viruses as well. And cold and flu season, it's right around the corner. It's literally about a month away. We're already seeing the very early signs of some flu cases starting to show up in the southeast. Yes, we're going to take a look at the flu map from the CDC today, which shows indications that there is a state in the southeast that is starting to show signs of that. But for COVID, we've been dealing with this major surge all summer. I don't ever recall adding so many COVID positives to the archives on my website. I've added quite a few this summer. There's still more I need to add. You can see here, we're going to be talking about one in just a moment. It's impacting everybody. People want to think COVID is over. It's not. Everyone is being impacted in some way, shape, or form. If you are really sick right now and you think you have a really bad cold, I got news for you. It's summertime. Please do yourself a favor. Do others a favor. Take a COVID test. Test to see if it's COVID. It very well could be. COVID is circulating at high levels. While it is starting to drop in some places in the United States, there's some areas that are still far too high, and there's some individual cities that are going off and doing their own thing where they are really rising. We're going to take a look at a few wastewater sites today where you will see just that happening up in the northeast section of the United States. So if you're new to my channel, subscribe down below, give this a thumbs up, hit that notification bell, share this video with anyone you know, and remember to leave your comments down below. Alrighty, our first story of the day comes from someone we talked about yesterday. Daryl Hall of Hall & Oates has canceled another performance, this time at the Albertsons Boise Open, due to COVID. He has tested positive for COVID at this point, and for those who did not see yesterday's video, he was doing a performance on Wednesday evening. He started feeling ill, had to cut the performance short. Turns out he has now tested positive for COVID, which is not a good thing. As mentioned, we are in a massive COVID surge in the United States. I guess you could say the old-fashioned phrase, better late than never. The United States is now going to be issuing more free COVID tests. You'll be able to get them, I assume, the usual way, covidtest.gov or whatever the site was. Be able to get them the usual way, and when that does come out, I will provide you with a link, and we'll share that when the time comes. But yes, this needs to happen. We not only do we need them now, fall and winter's coming as well, so we're going to see things drop a little bit. We're going to see a lull. Then right around the late fall holidays, and as we head into winter, we will probably see things go up once again, like we always do. Remember, COVID season, it happens all year round. And I did say things are starting to drop now. Remember, back to school outbreaks, they're becoming a thing. In fact, let's head over to my website. Don't have any new ones to show you today, but let's go down to the COVID outbreaks section. You can see COVID outbreaks in U.S. schools. Very early in the game, and already we have 1, 2, 3, 4, 5 of them. We'll probably be adding more soon. A lot of the northern states, schools will be going back after Labor Day, or in some cases next week. Here in Philadelphia, the Philadelphia School District does start back next week, so I'm expecting to hear that there will be COVID outbreaks, and we do see the backside of this wave that we're in right now will transition to those younger ages. And something else we're going to be talking about is back to college. Football starting up soon, so you can see individual towns that, while you may not see a state surging, you might see some towns that start increasing just because of the increased activity that they'll be seeing in these college towns. In the UK yesterday, there were 1,714 new cases reported for this week's update. That is down by 602. That's 26% less. Weekly deaths were 200. That was up by 7, 3.6% increase. Healthcare, they had 2,695 people admitted. That's down by 455. Taking a look at heat-related illnesses, they are still a thing. It would surprise me if this showed the same thing in the Northeast next week. It has not been that bad, but sometimes even when it's not bad, there's still heat-related illness calls showing up on this map, and we can see a lot of regions in the Southeast are still dealing with problems. Texas, it is really boiling hot right now in Texas. Taking a look at what's going on with the allergy map, and I have to refresh this. Yeah, there's quite a bit of red showing up. 40% of the country is in the medium to high status. We can see that generally from New Jersey, even New England, it's starting to worsen now. There's more oranges, more reds showing up. You can see even all the way back to Illinois, the upper Midwest, the plains, even in Nevada, there's problems now. The Pacific Northwest and Florida are probably the best areas, like Washington and Oregon right along the coast, and much of Florida is not doing too bad. Let's take a look at today's air qualities, and I do need to refresh this map. Let's see what we get for today, and we can see, yeah, there's starting to be some yellows showing up again in the east. The heat's going to be building over the weekend, but it's not going to be really that humid. It's just going to get hotter. The air temperatures probably will be upper 80s, close to 90s, in a lot of places in the east. Down in the south, you may see some humidity, but I think this will contribute to some more increased air quality issues. You can see it's starting to build up again, and I think that's going to continue to be the case probably for the next several days. The West Coast is improved from what it has been the past couple of weeks. Taking a look at what is going on now with this is my other channel. It's Climate Data Report. It's actually my other X account. I do have another channel, Climate Data Report. I really haven't had time to post on it, and I hope to do some tweeting on this in the near future. Maybe I'll tweet something for the heck of it after I'm done with this video. Moving on to Philadelphia for yesterday, 722 EMS incidents were reported. Doing a live look in Montgomery County, Pennsylvania. Wow, 17 calls right now. That's actually gone up. It was like 13 or 14 before I started this video. Respiratory emergency in Collegeville, Pennsylvania. That's not good. And just a scattering of everything else. How about Chester County? Chester County, we do see not one, but 2 sick person calls, respiratory difficulty. And I will say this. Though we are coming near the end of summer, I have noticed for deliveries, in case you don't know, I do deliveries. I've noticed deliveries have started to increase. I've noticed the number of leave at door requests have started to increase. We'll see if that's the case this evening. After this video, I go back out to work. Anywho, moving on now, Walgreens this week. The positivity rate is 37%. The prior week was 38.3%. Difference of down 1.3%. Total test, 13,913 versus 11,620. All right, I want to take a look at some wastewater. First off, take a look at this. This is Portland, Maine. And you can see here, seems to be all of a sudden, once again, Portland, Maine is seeing a significant increase of detections of COVID in wastewater. My friends, this is not a good thing whatsoever. Maine was looking like it was starting to show signs of peaking, but again, that is rising. Here's the national level for COVID. You can see, yeah, it's peaked, but it's hardly even dropping. Hopefully we start to see this dropping soon because we've been in high levels for the majority of the summer. And there was somewhere else I wanted to show you in the Northeast. I think that's over on the CDC site. We'll get to that in just a moment. Let's go down. Let's go out to the west. Let's see what's going on in Colorado. How about we go to North Parker, Colorado? We can see that is, wow, that is really starting to drop. And no, that's not a wonky movement. That's multiple updates of dropping. That, my friends, is some really good news. The viral activity level today in Canada is now high for COVID, low for influenza A, not detected for flu B. RSV is low. So, yeah, well, remember when it was moderate? Well, COVID is now high prevalence viral activity level in Canada. All right, let's get to some brand new CDC data. And we just showed you Portland, Maine a minute ago. Their epidemic status is now growing. Now, their cases this week were lower than last week, but with the way wastewater is rising, unfortunately, we may see cases come in higher once again next week. That's actually concerning to me because I'm traveling to Maine next week, or at least I hope I am. I don't know. I might reconsider that. We'll see here. Massachusetts is in growing status at this time. Vermont is in likely growing status. Pennsylvania likely growing. Ohio is now down to likely growing. I hope we can see a peak in Ohio relatively soon. If you were watching yesterday, let's just go to it real quickly. Yeah, Ohio had another 8,352 cases. They had a humongous increase from the previous week. I hope the fact that it went up a little faster means it's going to peak and drop soon. Oftentimes that is the case, but we'll just have to remain optimistic and see what happens. Take a look in the southeast, Alabama, Georgia, South Carolina, all growing at this time for COVID still, which is not good. Tennessee is growing, Kentucky, West Virginia, Indiana, Illinois. We can see here in the plains, North Dakota, South Dakota, Nebraska, still growing at this time. New Mexico, still growing. Then likely growing. We do have Michigan. We have Iowa. We also have Minnesota. We have Arizona, California, Idaho, Washington, Oklahoma, likely growing. Now, we do have some places likely declining. This is good news. North Carolina, Louisiana, Texas, and Alaska are likely declining at this time, but there's quite a few states that are stable or uncertain. Florida is one of them, New York State, New Hampshire, and I don't know why New Hampshire's coming up uncertain. I think there's an issue there with data. I'm going to show you a wastewater site. They're on a CDC webpage in just a moment. That is literally straight upward. Wait till you see that. And West Coast also has some states like Oregon, Nevada, Utah, Colorado, Montana, either stable or uncertain at this time. Let's take a look at some more data. This is not new data. The latest variant of COVID is the KP.3.1.1 variant. That will likely lead to some more school outbreaks. Taking a look at wastewater. This is what I wanted to show you. Take a look at this. This is up near North Conway, New Hampshire, like Carroll County, Oxford, Cumberland County. Yeah, take a look at this. Yeah, it is literally going straight upward. That is not good. Let's refresh this page. Let's take a look at the national level, which continues to be very high. And take a look at this. You can see it was trying to level off. Now there's a little upward movement again. So it may be trying to resume going up a little bit again. We'll have to see what happens with that. And something I am not happy about whatsoever is this. The number of low sites in the United States, those dark blue sites on this map. Out of total sites with current data, 1,270. Total number of wastewater sites, 1,463. Out of the 1,270 sites that are currently reporting, only 13 of them have 0 to 19% COVID detected. Folks, that is absolutely horrible. I cannot remember the last time that number was so low. Was it that low in the wintertime? It may have been. Maybe I just wasn't paying attention. But that is ridiculous, and that just shows you how high things are right now. Please take precautions. Please. I know you hate hearing about these. A lot of people really hate hearing about masking. If you have to go to a high-risk setting, there is no shame in wearing a mask. Why? You could get sick. You could go on to get long COVID. You could be hospitalized. Can you afford to go to the hospital right now? There are many people in the United States right now that don't have health care because it's too expensive, or they're one paycheck away from having a huge financial crisis, and they cannot afford to get sick or take time off of work. COVID doesn't care. COVID is going to impact you if you're not careful, and you could end up in the hospital. Can you afford a hospital bill right now? Chances are you cannot. Please take this seriously. Levels are far too high. The next color would be 20 to 39% COVID detected. That's 86 sites. Light blue is 279 sites. Really high, or moderate to high, is 486. Then really high, 80 to 100% COVID increase detected, 355 sites. We really need to get these numbers down because that is just totally ridiculous. Moving on. And here's another look at wastewater. We can see it is still relatively high or very high across much of the country. There are some places that are moderate, but for the most part, it's still far too high. We'll do a deeper look at wastewater on Sunday. Emergency department visits. Let's take a look at this now. And here's the United States level. It is starting to drop. This is some good news that I am happy to report. Hopefully it can continue to drop. Switching gears for just a second. I have to show you this. Look at Mississippi. This is for influenza-like activity. Yeah, it's starting to increase in Mississippi already. And you can see some coloring starting to show up in Georgia as well. Now, they're still minimal, but Mississippi has now moved to the low category, which is the next step above minimal. That is not a good thing. It's something we will obviously have to keep an eye on. And we can see District of Columbia, Washington, D.C., the capital of the United States, is also moved up to the next tier, which is the low category. And remember, flu does usually start in the southeast, and sometimes the cities, the bigger cities, it starts circulating first too. I mean, we're only at August 23rd, so we'll have to keep an eye on this. It is really early, and this is for data ending on August 17th. All right, let's get to some notes for today. Quite a few of them. Florida on Thursday had 2,208 new cases and 41 new deaths in their daily update. Oh, and I think we already talked about back to college, but yeah, this is move-in weekend for a lot of towns this weekend. Parents are going to be dropping off their kids. They're going to have to eat out somewhere. Please be careful. It's going to be really risky. If you live in a college town, consider avoiding going to where the move-in activities are. I mean, there's a good chance there could be COVID spread ongoing in these towns right now. Of course, we'll be looking at some college towns in Wastewater as time goes on. New Jersey yesterday had 726 new cases. The following states are weekly updates. Georgia, another 9,049 new cases and 16 new deaths. It's a heavily Republican state, but you do have Atlanta, which, it's maybe a little more Democrat. Maybe more people are likely to get tested in that area. But again, that's a lot of cases, and 16 new deaths is too high as well. Iowa, 515 new positive tests, and CDC reported 12 new deaths in Iowa. Kentucky, 3,463 new positive cases, 17 new CDC deaths reported. Massachusetts, 2,833 new cases, 21 new deaths. Minnesota, 2,757 new cases and 21 new deaths. North Carolina, 19 new CDC deaths reported. Nebraska, which is a Republican state, 832 new positive tests and 6 new CDC reported deaths. Ohio reports 8,352 new cases. We talked about Ohio, so we can skip over that actually. And Utah added another 1,134 to their number of people living with COVID. I guess that's what they call it there. And 6 new deaths. Vermont. Vermont is not doing well. I know we just saw CDC data that says Vermont is moderate. Okay, take a look at this. Vermont, 281 new cases and 9 new deaths, which is even bigger than the 7 they added last week. And mind you, at one time, Vermont was one of the best states, but on a per capita scale, Vermont only has just over 600,000 people. I mean, their population is gradually going up, but 9 deaths, that's a big number for the state of Vermont. And Washington, D.C. reports a large increase from an average of 90 cases to over 200 new cases this week. That is just not good whatsoever. And I'm actually concerned about that because usually when D.C. starts to see a rise like that, my city, Philadelphia, sometimes follows or has in the past with COVID waves. New Jersey today has reported, I believe it's 389 hospitalizations. Again, a much different number from yesterday. I don't know why they just picked numbers out of a hat. I don't know what goes on to cause this. And naturally, all these numbers just change. So you know what? We're not even going to report on the rest of New Jersey. New York State, 2,068 new cases added. Taking a look at what's going on with their hospitalizations, didn't really drop all that much this week. Yeah, they're dropping slightly. Really not that much. They're just bouncing off the top at this point. 1,190 cases, 115 people in the ICU. That is lower than yesterday. Hopefully we can start to see a drop next week. But reminder once again, post-Labor Day and back to school in the past few years did cause a few weeks of rise once again. Something we'll have to look out for. Los Angeles, good news. Hospitalizations have flattened. Cases are now dropping. Test positivity rate was dropping. It did start going back up a little bit, but I'm pretty confident that LA, hopefully at this point, has peaked. Emergency department visits are dropping there as well. California as a whole, though, test positivity rate went up a little higher, 14.4%. That is up by 1%. Taking a look at what's going on with influenza, and we can see here, that's not rising at this point. Alrighty, folks, that does it for the Friday edition of the Pandemic Update. We'll have another update again tomorrow, and then Sunday, and then come Monday, our updates will be from a different state. I will be making my way up north. It will be an out in the wild update on Monday with the latest data on deaths from BNO and whatnot. Who knows what state that will be in? It'll be along my way that I record that. So I will see you all again tomorrow. If you enjoyed this video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and my website, once again, is datareport.info, where you can find a wealth of information on COVID studies, people who have had COVID, famous people, and news on other viruses as well. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic weekend, and see you all again tomorrow. Thanks for watching.